The JBI Evidence-based Database contains over 4,500 resources in a variety of fields of health and medicine and is accessed by over 65 countries worldwide. The mental health field of JBI contains 600 or more resources that cover a broad range of mental health topics that can be accessed at the point of care to inform clinical decision-making. The resources include evidence summaries, recommended practice documents, and best practice information sheets. I'm Dr. Amy Finlay, Research Fellow here at JBI and Field Editor of the Mental Health section of the database. I'm passionate about connecting evidence-based practice to clinicians at the point of care. We summarise the best available evidence and present them in a concise and easily digestible format. You don't have to spend hours reading systematic reviews and guidelines. We do that for you. These evidence summaries are rapid review-like documents whereby evidence is methodically identified, critically appraised, and synthesised in a clinically meaningful way. The evidence summaries contain best practice recommendations to inform the reader at the point of care. They address a specific set of clinical questions that are mapped to a taxonomy based on the DSM-5 and ICD-11. The areas in the database include cognitive decline, dementia and delirium, mood disorders, anxiety and depression, suicide and suicide prevention, neurodevelopmental conditions such as autism or ADHD, severe mental illnesses such as schizophrenia and personality disorders, drug and alcohol addiction, post-traumatic stress disorder, and many, many others. The database also includes evidence summaries on various screening tools, assessment and management techniques for those mental health conditions, both pharmacological and non-pharmacological options. The mental health database also covers elements related to healthcare professionals' working life. So for example, creating mental health care plans for patients, behavioural change recommendations for the patients within hospital, and this also extends to hospital policies such as supporting and managing staff burnout and work-related stress. The database contains recommended practices, which are essentially procedural documents that offer step-by-step guidance and are peer-reviewed and are linked back to the evidence. The downloadable example regards mental health care planning and is linked to the mental health care summary, both of which you can download as part of this field promotion. Finally, the database contains best practice information sheets, or BPISs, which are summaries of a systematic review that have been published with the JBI Evidence Synthesis Journal. The BPIS contains an infographic that has best practice recommendations. For download, we have a BPIS on strategies to mitigate burnout in emergency department staff. We encourage all healthcare professionals to consider the JBI Evidence-based Practice database mental health care resources to provide guidance on their clinical decision making. We are here to help you as you help your patients with their mental health journeys and illness recovery.